I wish to reiterate the firm call I made last week, which is indeed referring to a plausible endgame for the pandemic. Not to say that it is now all over, but to highlight that in the European region, there is a singular opportunity to take control of the transmission because of the congruence of three elements. First, a large capital of vaccine-derived and natural immunity by Omicron. Second, a favourable seasonality pause as we move out of the winter. And third, a lower severity of the Omicron variant, now well established. The European region has recorded 12 million new cases in the past week. This is the highest weekly case incidence since the start of the pandemic and is largely being driven by the highly transmissible Omicron variant, as it sweeps from west to east. 30% of all COVID-19 cases since the pandemic began have been reported this year alone. 22% of all tests recorded are positive. Hospitalizations continue to rise, mainly in countries with lower vaccination uptake in vulnerable populations. This rise, however, is not as rapid as the case incidence rate, and overall, admissions to intensive care have not increased significantly. For now, the number of deaths across the region is starting to plateau. There is absolutely no contradiction over there. So WHO Geneva is obviously speaking about a global perspective. We here in the European region have a unique situation. First and foremost, that once the Omicron wave will subside, there will be a large capital of immunity, be it thanks to the vaccine or due to the infection. I mean, the continent has, in general, quite high vaccination and booster rates, number one. Number two, seasonality is decreasing. And the third one, we know that Omicron, now that's quite well established, is milder, particularly in the vaccinated and the boosted people. So the pandemic is not over, as Dr. Tedros is rightly telling so, but the point that Dr. Tedros is making, that we in the European region have been supporting from day one, is the need for international global solidarity. If 2021 was the year of vaccine production, let 2022 be the year of vaccine equity.